Hi everybody. Today I'm going to talk with you about giftedness and specific learning disorder. They can co-occur. I'm Dr. Leslie Blevins with Enilda Clinic at enildaclinic.com. Let's get started. So giftedness is whenever you have intellectual functioning that allows you to process information at a much higher level than is typical for your same age peers. And it's typically defined by your school district. And so the definition of giftedness is different all across the country. But it usually means that you have a pretty high IQ and that you can reason pretty well with words or with pictures. Oftentimes we consider somebody gifted whenever they have a domain of giftedness, and many times somebody who's gifted is gifted in a domain but has some area of weakness where they might be a little bit more average or closer to average. And so sometimes it leads to having difficulties with learning. And with specific learning disorder, what that means is that you have a specific area in your thinking capacity that leads you to struggle with either reading, writing, or math. And there are specific domains within each of those that you can struggle with. For instance, with reading, there is accuracy, fluency, and reading comprehension. And you can have a specific reading or specific learning disability in the area of reading accuracy or reading fluency or reading comprehension. Now, dyslexia is an alternative name that we would give whenever someone has a specific learning disorder with deficits in either reading accuracy or reading fluency, because those are considered more basic reading skills, and that's what dyslexia means, is that it's a basic reading disorder. Reading comprehension is a very advanced type of academic task where you're using the basic reading skills in order to do a more language-based processing skill. And so you can have a child that has, really advanced cognitive skills, but still struggles to do any type of academic task. I think there's a big misconception that an intellectually gifted person is going to be intellectually gifted in every single thing that could be thrown at them, and that's just not the case. Oftentimes we actually see that kids who are gifted might process information a bit slower, and so even in that way we might have to give them a little bit more time in order for them to put forth their best work. And so these are some of the things that you might want to look out for whenever you are seeing a child who is academically gifted, but you're thinking something's not quite right with their academics. One would be that the child has to spend an extraordinary amount of time or effort in order to understand or perform the task at hand. If you think about the amount of homework that's being assigned, typically the teacher is expecting the child, depending on their age, to spend only so many minutes doing that homework assignment. So let's say it's in second grade, maybe the teacher is expecting the child to spend only 10 minutes on that homework assignment. Now, if the kid is in ninth grade, the teacher might be expecting the child to spend 40 minutes on that homework assignment. And so there will be a difference there, but on average, the teacher is going to be expecting that the assignment itself should only take so long. For some children, the ones who are having difficulty in that specific academic domain, they might be spending upwards of 2 or 3 hours to get through the homework assignment. That is a big indicator that something just isn't going quite right. And sometimes you'll have an academically gifted child spending that amount of time, or even going through just leaps and bounds of effort to try to comprehend and perform at the level that they do perform in other areas. And so you might see a gifted child studying extraordinarily long amounts of time so that they can get the A that naturally comes to them in their other subjects. You also might see that the family is providing a lot of tutoring and a lot of support because the child isn't able to get the A that they would normally get in their other subjects in this one target subject. And so there are lots of efforts being put in that typically aren't needed for this kid. And so what we tend to see in the school for these gifted children is that their grades themselves might be closer to B's or C's, and they might even be A's, but what we're hearing is a lot of distress and a lot of lost opportunities for the gifted child to participate in social and leisure and extracurricular activities because all of their time is being taken up with studying and practicing in a very inefficient way skills that they have a disorder in. And so as a teacher or as an education provider or as a parent, if you're seeing this, it might be something worth taking a look at and getting some targeted supports for because they do co-occur. You can have giftedness and you can have a specific learning disorder. I think the benefits of understanding why you would want to know this is that it can help preserve your child's self-esteem, to know that their brain is just working differently and that they can identify some accommodations, they can utilize specific types of interventions in order to not struggle for so long or to struggle so hard in order to get the performance that they're going for. And also just to sort of accept that they don't have to be perfect and they don't have to have such a high level of performance in absolutely every area of their life. Sometimes I think with gifted kids, because things come so easily for them, whenever they're encountering this, sticky spot where it's just not coming easy, they think that they're doing something wrong. And understanding that it's a disorder the same way if a kid had a cold, they've done nothing wrong. It just is what it is. They just have to take care of themselves. They have to be compassionate to themselves. They have to treat themselves well so that they can get better and they can function as well as they can and lead a life that gives them meaning, right? And it's the same thing with a specific learning disorder. It's kind of putting it in perspective and not giving it too much of their life and not giving it too much of their focus, but also giving them the supports so that they can, learn whatever it is that they're trying to learn. And so I think a lot of the resources that you might be putting in that feel inefficient and like you're spinning your wheels in the mud could actually be put towards changing your child's mindset so that they can make more progress and they can feel good about themselves. And then for the teachers out there, I think you're a big part of that. You're a big piece of the puzzle to help these children to grow up with a healthy mindset so that they're continuing to make progress and not getting stalled out and giving up because they weren't able to have a perfect performance. Okay, so I hope that you enjoyed this video. I have learning videos every week, and if you'd like to join the email list, you can go to enildaclinic.com and sign up there. All right, thanks guys, bye.